It's good to see a positive end to many stories, because we talk about sort of the negative side of it, don't we? But that's a brilliant case study. We're joined now by GP Dr. Helen Wall in the studio. Thank you so much for coming in. We were just saying that GPs train for 7 years, don't they? But that you feel there's not enough training on issues like eating disorders.
Yeah, I think this goes back to medical school, really, as the GMC have highlighted. There was an investigation done in 2017 after the sad death of some young people with eating disorders. And the Parliamentary Health Service Ombudsman highlighted that there just wasn't the training that needed to happen in medical schools and in the years after medical school, because doctors go into what we call foundation jobs for a couple of years, learning the ropes, doing hands-on work. And pretty much it was non-existent, maybe 1 or 2 lectures when it was looked into, but it certainly needed to change. And the GMC, as we've heard in that report, have put some guidance in for medical schools, but they can't mandate what a medical school teaches. What they can do is demonstrate what the outcomes a person needs to have at the end of medical school. So there is variation still, I believe, in what amount of training and what programmes are going on in medical schools across the UK.
And what are the challenges when it comes to eating disorders and training GPs? What is it specifically about eating disorders that you think is lacking at the moment in terms of the gap in knowledge? Because I'm assuming that at some point a GP would learn about mental health problems, but why is an eating disorder different?
I think it's multifactorial, really, Sally, and there's a few reasons behind it. One is, GPs, all clinicians, learn from meeting patients with lived experience. That's how we learn our best medicine. And whenever I meet anybody with a condition, I always have a catalogue in my mind of previous patients that I've met. And it's really difficult for people to get placements in these services because they're often quite small services, they're often quite pressured services. There's very few eating disorder specialists in the country. So getting a range of medical students or GPs through these placements to meet these individuals and learn alongside with the patients is very difficult. But we can't use that as an excuse, because all we really need to be able to do as a GP, I believe, is get rid of this misconception that stratifies all across the society. It's not just healthcare professionals. There's a huge misconception that eating disorders are a fad, are a phase. You have to be really underweight to have an eating disorder. All of that is untrue. Eating disorders cross all sex, all genders, all races, all ages. And, you don't have to be underweight to have an eating disorder. You could be overweight, you could have a normal weight. It's a true mental disorder. It's a really complex condition.
So if somebody comes to you with a problem, what options are available to you as a GP now? And does that vary depending on where you are as well?
It will vary depending on locally commissioned services and the criteria into those services. But NICE, our clinical guidance experts, are very, very clear that we need to refer people very early on, because the earlier someone is referred to an eating disorder service and gets that support, the better their chance of full recovery. And full recovery, as we've seen in the report, is possible.
And what does treatment look like?
Treatment looks like it's very varied, because there's a whole spectrum of eating disorders. It's not just anorexia, binge eating and a whole array of things. So treatment will vary, and it's very tailored to the individual, but in essence a lot of it will be different forms of therapy. Therapy with the individual, therapy with the family, because we need to remember that this doesn't just affect the individual, it affects the families, and it can have catastrophic effects. Families can really implode with this, but it's important to highlight that this is nobody's fault. This is not, there's no blame game in this. There shouldn't be. It is just it's an illness, a really serious illness.
I'm also aware that people might be watching this at home. They might be struggling themselves, or they might be thinking about a family member. What's the best piece of advice for either that person who is struggling with an eating disorder this morning, or somebody who's thinking, can I have a conversation? What do I do? What's the next step for me?
So I think we hear time and time again, don't we, that healthcare professionals haven't taken people seriously when they've presented with eating disorders, and that's really soul-destroying to hear. And I accept that happens. I know it happens. I've seen it. I've met patients where it has happened. But I don't want people to be put off by trying to seek that help. Go to your GP. If you don't get any satisfaction from that GP, ask to see a different GP. There is really good, clear advice on the Beat charity website, which talks about how to approach your GP with this, what to say to them. If you're not confident, write it down, give us a note, hand us a letter. There's lots of ways and really good tips on Beat charity website as to how you can get around the problem of having to tell someone about this.
And how much is age a factor in all of this? We see, a lot of the reports that we've done, we talk a lot, don't we, about young girls in particular, but I know this affects boys, men, women. if someone maybe has struggled with an eating disorder for many, many years, what would you say to them?
It's never too late to come forwards. We think that the average time somebody waits to seek help is about 3.5 to 4 years, which is a hell of a long time to deal with this on your own without the support. But it isn't too late to come forward. It does affect everyone. About 25% of sufferers, and it's about 1 in 50 in the UK that suffer with an eating disorder, which is huge. About 25% of those will be male, and it does span all ages. We often think about young Caucasian, young girls wanting to be thin. This is it's a misnomer. It's massively different to that. You know, that's just one part of it.
Thank you so much for coming in. It's really helpful advice. And we should say as well that there are details of organisations offering help and support. If you are living with an eating disorder, if you're thinking about a loved one, the BBC Action Line has got lots of information on